All right, let's dive right in. Today, we're going to explore one of the most fascinating and critical connections in all of medicine, the link between our hormones and our mood. We're really going to dig into the neuroendocrine hypothesis of depression and see how the body's own chemical messengers can actually drive this incredibly complex disorder. So picture this. A patient walks into your clinic. They tell you they're feeling incredibly low, just exhausted all the time, and have completely lost their appetite. You know, it's a classic picture of major depression. But as a clinician, you have to ask yourself the big question. Is this all just happening in their head, a problem with brain chemistry? Or is there something deeper going on, a problem with their entire system? And here are those classic so-called neurovegetative symptoms we see. That persistent low mood, and of course, anhedonia, the inability to feel pleasure in things you used to enjoy. Then you've got the disturbed sleep, that profound fatigue, the changes in appetite, and a drop in libido. This is the reality for millions of people, and it's what we base our diagnosis on. Now, to really solve this puzzle, we have to look beyond just serotonin and other neurotransmitters. We need to zoom out and look at the body's master regulatory network. I'm talking about the endocrine system. Okay, so take a look at this. This is the fundamental chain of command. Think of the hypothalamus, right at the top, as the command center. It sends out signals to the pituitary gland, which then releases its own set of hormones. And those hormones travel to organs all over the body, like the adrenal glands or the thyroid, telling them what to do. This whole network, from brain to body, is what we call the hypothalamic-pituitary-end organ axis. And it is absolutely central to what we're talking about today. In fact, there's a whole field of study dedicated to this called Psychoneuroendocrinology. The source material we're looking at calls it a neuroendocrine window, and I love that description. It's our way of peering inside and seeing exactly how our hormones are directly influencing our minds and our moods. So, where do we start our investigation? Well, our first major clue comes from the body's #1 stress response system. And the literature makes a really bold claim about this next point. It calls it possibly the single most important discovery in the entire field of biological psychiatry. So you know it's going to be a big one. And here it is. It turns out that in a huge number of patients with major depression, their main stress axis, the hypothalamic-pituitary-adrenal axis, or HPA axis, is stuck in overdrive. It's chronically hyperactive. Their body is basically locked in a state of high alert, 24/7. So how does this actually happen? This is where the CRF hypothesis of depression comes in. It goes like this. Chronic stress, or maybe some genetic vulnerability, causes the